Okay, so now we've identified the systolic stress, that tends to occur after a mild traumatic brain injury or sport-related concussion. But really, where do we go from here? Um, so often, and almost every single time I see any patient for any kind of research study, I get asked about treatment, and for the longest time, everyone's been saying that rest is best. And, what that refers to is, after you get a concussion, you have all these symptoms, you should sit, relax, and wait till you're back to normal before, you start any kind of exercise or any type of program that requires you to progressively overload. And really, more and more research now is suggesting that, hey, this isn't really the best way to go. Again, before you get told to limit your screen time, to wear sunglasses when you go outside, don't go too hard too soon. And a lot of those are still, really, really prominent applications, right? For a lot of people, screen time is what causes their headaches. Going out in the sunlight after they take a hit to the head where they have all these problems, that really causes their symptoms to worsen. So you should be very specific and personalized with this approach. But more and more research now is suggesting to introduce exercise at least a little bit earlier during the rehabilitation program. It should be sub-threshold. With the sub-threshold exercise, there's actually a really big article recently in the British Journal of Sports Medicine, which included some people out of Calgary, so it was nice to see Canada represented. But they were able to show that most research now suggests exercising can help decrease recovery time and restore function in those with persistent symptoms, right? Whether it's, introducing it as soon as patients stop feeling symptoms or as early as possible within the treatment modality. As long as you do it to the point where symptoms aren't being overly stressed, or there's no symptoms being introduced or excessively exerted for the patient, that seems to be a good way to go. It could be that slow exercise and trying to, introduce some kind of sub-threshold exercise can help restore autonomic nervous system functioning at an earlier rate. But, when it comes to systolic stress and the way heart function should be monitored when dealing with concussions, that still has to be, studied much further. There's still not enough research in that whole realm, including, for example, if somebody has been injured and has been symptomatic now for 10, 15 years, and, they've been resting for 10, 15 years, they may have even tried some exercise options 10, 15 years ago, and they're still very symptomatic. Well, how do you treat somebody like that? And what we're trying to show, or, when I was in grad school, one of the main ideas was, well, can we target the autonomic nervous system? Can we help find a way that targets the cardiovascular system to help treat some of those symptoms that might be occurring due to autonomic nervous system or physiological stress? Okay, so, exercise seems to be a good option, but besides exercise, is there anything else that might work? And this topic I'm going to talk about now requires a bit of a background. So, in 2016, I started graduate school, and that's when I started to explore the area of cannabinoids and neuroprotection with my supervisor. There's a strong physiological background that suggests that cannabinoids can be very beneficial for mild traumatic brain injury dysfunction and autonomic nervous system dysfunction as a whole. And really, it's associated with something called the endogenous cannabinoid system. If there's interest in that, it's an area I can explore in a further video. But there's this whole idea that we're born with an internal cannabis system where we have cannabinoid receptors and specific ligands that bind to these receptors that function very similarly to compounds that are in the cannabis plant. And, what we ended up doing to explore this further was we conducted a case series. So we had 4 patients, and these patients were taking cannabinoids, so CBD or cannabidiol specifically, under the guidance of their physician, and they were taking it at high doses as well. So some of these patients, they've been injured for almost a decade. They haven't returned to work in so many years, and they haven't been able to. But as soon as they started taking CBD, all of a sudden, we started seeing tremendous improvements in their symptoms. And not only their symptoms, but we were measuring their blood pressure variability and their heart rate variability. And we started seeing tremendous improvements in these areas as well. So this whole idea of something like cannabidiol or CBD being beneficial for people who have concussions is an area that we started to explore further. And we even ended up writing a review on this area. So we published this in 2020. And, what we tried to show is that, okay, a concussion can, lead to these increases in glutamate responses and pro-inflammatory cytokines and so much oxidative stress that eventually, it can decrease cerebral blood flow. It can increase the amount of stress your body's under. It can decrease the strength of the communication areas between your brain regions and between your brain and your heart function as well, so that a heart-brain axis. And altogether, a concussion can increase the risk of another problem occurring over time. So what we decided to do is explore how CBD can potentially, reduce the likelihood of another injury occurring or help increase neuroprotection, so protect the brain. And what we found was that with the introduction of CBD, we can actually neutralize a lot of the problems that initial mild traumatic brain injury or concussion can induce. And with our 4-person case series, we were also able to show that, hey, this can also occur or be beneficial in people who have post-concussion syndrome, so symptoms for a very, very long time after they've taken a hit to the head. Now, after doing all this research on cannabinoids and CBD and trying to see how, it can be beneficial for people who take a hit to the head, my graduate school supervisor has recently been funded by the NFL Players Association to investigate how CBD can help reduce sport-related concussions, help improve recovery times, and even players who have been retired for a very long time now but are still having symptoms from their playing days. Can taking CBD be beneficial for them to help improve their lives? Can it reduce their concussion symptoms? And can it help reduce the prevalence of post-concussion syndrome as a whole? So these studies are ongoing. It's a multi-year process. And once they're complete, I'll be sure to make another video to talk about them as well. Okay, I hope this was beneficial. I hope you learned something, and please leave a comment on what you'd like to see me talk about next. Thank you.